It is Saturday, March 21st. Yesterday I was given the option to transition to telehealth only instead of continuing to see patients in clinic. This is in light of the COVID-19 pandemic, as well as the fact that we are running low on PPE, just like every other healthcare provider in this country and, frankly, most of them around the world. I've decided to continue seeing patients in the clinic. We will be carefully screening them, and those with active COVID-19 symptoms are going to be sent to an acute respiratory clinic where they will be further screened, and it will be decided whether or not they qualify for testing and that type of thing. That way we're not bringing COVID-19 patients into the clinic. Otherwise, we're going to do as much as we can via telehealth. So my patients that are at really high risk, we're going to communicate with them over the phone as much as we can. We're going to delay as many routine med checks and things like that, particularly in high-risk individuals. That would be folks older than 60 or people with medical conditions that would increase their risk of having a bad outcome. So heart disease, lung disease, diabetes, kidney disease, immune compromise, things like that. So this decision was not very hard for me. And I'm certainly not passing judgment on any provider who decided to transition to telehealth only based on their own personal risk factors, as well as the risk factors of their staff and their own situation and so forth. My risk factors are fairly low, as well as those of my staff. So basically, I feel like I took an oath to take care of people no matter what, and that's what I plan to continue to do. So my patients that catch COVID-19, they're going to be obviously diagnosed at an outpatient clinic, but then we will provide as much support and care as we can should they remain in an outpatient setting. Any of my patients, that catch COVID-19, hopefully we can get them through this. The ones that unfortunately that don't, if we have anyone that COVID-19 takes out, they're going to go out knowing that their healthcare provider was fighting for them. Again, I'm fairly high risk or low risk if I catch this myself. But on the off chance COVID-19 takes me out, I'm going out knowing that I did the best I can. And at the end of the day, I think that that's all that matters.